And the views that I'll be presenting today, these are my personal views, they don't reflect that of my organization. So my in-laws actually stay in US. You'll be surprised to know my in-laws stay here. And when I told my wife I'll be traveling to the US alone, so this is how she reacted. Okay, so since this case is from India and India happens to be an emerging market, so I'll request you to put on your emerging market lens, because if you look at the emerging markets, they differ vastly from the United States. So some of the things that you might take for granted here are vastly different in a country like India. So I would request you to put on your emerging market lens. Now I'll give you some interesting stats about India. Since this case study is from India, I thought it would be good to put some perspective about India before we go into the actual case. So we all know India has a population of 1.3 billion people. So currently we are the second most populous country in the world after China. Then some great things happening for India. So India is already amongst the top 10 economies in the world. Some indicators of that. So the fourth highest number of billionaires in the world are actually in India. I'm not sure whether some of you are surprised. But then while there have been some great things happening for India on so many other fronts, if you look at the healthcare scenario, there is a lot of, I would say, challenges. So even today, the per capita GDP of India is slightly below $2,000. So you can imagine for a country of that size. Also, if you look at the doctor to population ratio, it's pretty low. We barely have one doctor for 1,000 people in India. Also the healthcare spending, so apologies with the fonts are slightly messed up, but then you can listen to me if the fonts are messed up. So we barely spend 1.4% of our GDP on healthcare. The per capita healthcare spend in India is as low as $16. If you look at some of the developed countries, that spend can be as high as $8,000, $6,000 per person. In India, it is $16. And primarily, if you look at the Indian healthcare market, it's mostly out of pocket. So people pay from their own pocket to get treated. And in terms of hospital beds, we barely have 1.3 hospital beds per 1,000 people. So this is northern part of India. This is a place called Ladakh. This is the southern part of India, a place called Kerala. I don't know if any one of you have been there. It's very beautiful. This is of course the Taj Mahal, and this is a beautiful temple from the south, is the Meenakshi temple. Why am I showing this here? Let me tell you, India is an extremely diverse country. So if you show these four pictures in isolation to someone, probably they wouldn't say that this comes from the same country. So extremely diverse country. Now, why this particular case? I'll come to the details of the case, a rather interesting one. So what was done? There was this company, or there is this company called Diabeta Care, and this company primarily has a service offering. So they run their own clinics, diabetes clinics, and they came up with an interesting device. So Diabeta Care tied up with Vodafone. I'm sure all of you know Vodafone. Vodafone is a global telecom operator. And what they did was, so Diabeta Care tied up with Vodafone to launch glucometers. Now this was few years ago. So the uniqueness of these glucometers I'll come to later. But then initially they had a tie-up with Vodafone. They did an interesting pilot in Bangalore, which is a city in southern India. And they had plans to scale up this pilot to a massive level. And not only throughout India, they had intentions to provide this service outside India as well. So what exactly were their plans? So this was the proposed solution and how it worked. So this was a chain of clinics, diabetes clinics, who came up with this glucometer. So they introduced a glucometer. Now the uniqueness about this glucometer was that the glucometer came with an inbuilt Vodafone SIM card. Now, as I mentioned earlier, put on the emerging market lens, some of the solutions here, this might look pretty rudimentary, but in a country like India 5-6 years ago, this was rather, I would say, revolutionary. So the glucometer had an inbuilt Vodafone SIM card, and the beauty was that once a patient took the blood glucose reading, they need not connect this glucometer readings to say a mobile phone, or they did not need internet connectivity. the blood glucose meter on its own with the embedded SIM card sent the reading, the blood glucose reading, to the concerned doctor. So this was how they thought they could revolutionize, say, diabetes management by getting people to test themselves and also get the doctors involved by, say, sending them the reading without the patient having to do anything. So they need not connect this to an app, they need not need internet connectivity. Say 5-6 years ago, I would say the bandwidth and also the charges for internet data in India were exorbitant. So at that point of time, having a solution which did not need internet connectivity was rather revolutionary. So why did it make sense? So this kind of a tie-up, this kind of a device made a lot of sense, because if you look at these numbers, they were pretty staggering. So India has the second highest number of people with diabetes in the world. The number is 67 million. That's pretty huge. In fact, India has more people with diabetes than the population of these countries. So India has more people with diabetes than the entire population of Russia, Canada, UK and France. So that's how big a problem it is in India. Now, if you look at the current situation, of course it is challenging with 67 million people with diabetes. That number is projected to go up to 125 million people. That's staggering, and that too in the next 20 years. Also, the growth of diabetes in India has been phenomenal. These numbers, they talk for themselves, and for a poor country like India, we are spending a lot of money on managing diabetes. Now, if you see further, it made further sense because even in a developing country like India, the non-communicable diseases say contribute to about 55% of the deaths, and diabetes is, of course, one of the leading causes of death in India. Also, if you look at the other numbers, so India with a population of 1.3 billion people already has 940 million mobile phone subscribers. So if you have a solution which you have a tie-up with a leading telecom operator in India, Vodafone in fact has 200 million plus mobile subscribers in India, and say if we apply basic estimation, so 10% of the adult population in India has diabetes. So these are mostly adults who have mobile connections. So if Vodafone had 200 million plus mobile subscribers, we can safely assume that almost 20 million mobile subscribers of Vodafone had diabetes. So the opportunity was huge. Now, what did Diabetacare manage to get right? So for a startup, so this is a startup company having few clinics managing diabetes, and they came up with a single device. I think what they got right was they could convince a company, a huge giant like Vodafone, which had, say, presence in 70 plus countries, to agree to collaborate with them. I think that itself was a great achievement for them. So this is something they certainly got right. But then I'm sure you would be keen to see as of today. So where does Diabetacare and Vodafone, this tie-up stand today? So I did some research. So Diabetacare as of today, since the conception of this company, has been able to treat about 150k patients with diabetes. So that's been over a period of 6-7 years. If you consider that time frame, 150k patients do not seem to be that high a number, and also all of them would not be using the device that we just spoke about. Now, what's happening at Vodafone? So I looked at the latest annual report, and it doesn't even mention about this tie-up. So when they had this tie-up, there was a lot of press coverage. There were a lot of, I would say, impressions that they got in the media that this tie-up has been in place. Vodafone is about to revolutionize diabetes care. But then in the current annual report, this tie-up doesn't even get a mention. So what could have been done better? So if you look at various aspects of this case study, I think they could have got a lot of things right. First and foremost, so when they came up with this tie-up, they had advertisements in prime time television, and the advertisement showed an elderly couple taking a vacation, and the elderly person here is trying to sneak in some sweets. Of course, like any wife, the wife is not very happy with him ordering sweets, but then he flashes his diabetes care reading, wherein he's been able to say take his blood glucose reading, and he gets a message that of course you can go ahead and eat that dessert. The problem with this approach was, say you don't go on vacations every day. If you have a solution, say which helps you in managing diabetes, if you want to form habits in people, the solution should be used as frequently as possible. The whole communication approach did not in fact convey that you need to use this as often as possible. There was no way they could have formed habits which say people with diabetes in getting them to use say this glucose meter every day at least 2-3 times in a day. So I think the communication approach could have been much better. The approach did not prompt people to say make this a habit. What else could have been better? I think both the companies didn't get trends right. So this was 5-6 years ago. Nobody would have imagined that India would have say the lowest average cost for 1 GB of mobile data in the world. So 5-6 years ago, mobile data was extremely expensive. So I remember having a 1 GB plan for a month 5-6 years ago itself was a big luxury. But then they couldn't predict this particular trend. So one company, one telecom operator came in and completely revolutionized this. But then they could have predicted this. One of their key differentiators was that you need not have an internet connection to say get connected, because of course internet prices were expensive. But then one particular company has been investing billions for the last 6-7 years. They could have been better at predicting future trends that data, although is expensive today, it will be very cheap going forward in the future. This is something they could not predict. Also, this is the actual picture. So this is the actual picture I hope you are able to see in the background. So those long queues that you see are actually patients at a hospital. And this is not an exception. If you come to India, you will see most hospitals, be it government-run hospitals or private hospitals, they're extremely crowded because we are a country of 1.3 billion people. Now just imagine if there is such a lot of patients visiting doctors, you also saw the doctor to patient ratio is also not very great in India. In India, a good doctor, even in the private setup, say treats more than 100 patients in a day. So just put yourself in this doctor's shoes. Say if he's getting readings from his patients, from their glucometers, do you think these specialists have the time to say look at those readings and actually respond back to the patient saying that okay, it's good enough for you to have that dessert? That's not going to happen. So the company did not actually look at the real scenario around them, wherein the specialist or even the generalist who treat diabetes, say they have more than 100 patients knocking at their doors every day. There's no way you can expect doctors to actually look at say patient reports and then respond to them in real time and say tell them okay, you're fine, go ahead and do whatever you want to do. Also, I feel these two companies did not realize that there were competing interests here. So say this particular company, Diabetes Care, they had their own set of diabetes clinics and they had a device which had some innovations. Now, they failed to recognize the fact that if a patient goes to say some other hospital, not their particular clinic chain, if they go to some other hospital or some other specialist, why would some other hospital chain or some other specialist recommend a device which comes from a competing chain of clinics? So I think there were competing interests here which both the companies failed to recognize. So even if the device would have done well, the service would have done well, it would have always remained restricted to the chain of clinics that Diabetes Care had. It wouldn't have say become popular with other hospitals and other clinics because they wouldn't promote a product coming in from their own competitors. Also, in India, there have been a lot of studies. Studies around, say, the awareness levels about diabetes. I'm just showing one fact here. So there was this large study which had more than 16,000 people. So in fact, 40% of urban residents whom they interviewed for this survey didn't even know that there is a condition called as diabetes. Just imagine a scenario, 16,000 plus people is a very decent number. And say this is urban India where relatively the education levels are much better than rural India. 40% people surveyed in the urban areas did not even know that there is a condition which exists and it's called diabetes. So both these companies could have done a great job. Vodafone had 200 million plus subscribers, and today, with say mobile data becoming cheaper, I think Divita Care could have looked at other aspects as well. So there is a great opportunity to educate patients, and they had a partner who had a reach of 200 million plus people. I think educating people with diabetes and also their family members was a great opportunity, which both these companies didn't capitalize on. Also, we looked at both the companies. I personally think this was a lopsided tie-up. It was not a, say, collaboration between equals. So Vodafone, a company which had a presence in more than 70 countries in the world, it's a global giant, the number 2 mobile player in India. And this particular company, Divita Care, was a startup. It was a small company, they could convince Vodafone to tie up with them. But I think this was not a partnership between equals. And even if they would have gone ahead, I'm sure they would have faced a lot of issues, and we saw the results today. So the Vodafone annual report doesn't even mention about this tie-up. So in a nutshell, I think what they could have improved and they clearly overlooked was the communication strategy was not the correct one. They should have got better communication in place rather than say showing scenarios which are not a day-to-day occurrence. They could have come up with a better communication plan, inducing people to use the glucometers more often. Also, they could have anticipated trends better. The writing was on the wall. There was a big competitor who was laying fiber optic cables, spending billions every year to ensure that data becomes the new oil. So in India, it's already happened. They could have predicted this, but then they didn't anticipate these trends well. Then the stakeholder support, I think they were expecting too much from doctors. The current scenario in India, where every doctor sees more than 100 patients in a day, they are inundated. I don't think any doctor was in a position to look at those messages and respond back to the patients. So I think stakeholder support, they just didn't take that into account. Also, there were so many other gaps. We all know if somebody has to manage diabetes successfully, it's not only about say monitoring your blood glucose level, it's so much more. You have to get the exercise right, you have to eat the right food, you have to consult doctors regularly, do regular tests, manage your weight, so on and so forth. There were so many other things, if not all. They could have done a lot with 200 million mobile subscribers with Vodafone, assuming even 20 million had diabetes, or say there are so many family members who are also stakeholders. I think they didn't address these gaps well. Also, competition, they didn't anticipate the fact that there are clearly similar services out there who would never promote their products because they were competing services. And this is clearly not a partnership between equals. Even down the road, even if they would have done initially well, the pilots would have gone well, I think down the road it would have been a difficult partnership to manage. So that's it from my side. Thanks a lot for your patient hearing. I think we have about 10-11 minutes left in case if you have any questions. I'll be happy to answer them. Yes?
Is the program still going?
It is. So although you might not find details on the Vodafone website, but then the Divita Care website does mention that they have these glucometers which still have the Vodafone SIM card.
And does GSK in India have anything to do with it?
No, as I mentioned in the start, so these are my personal views. I'm not here as a GSK employee. I'm here in my personal capacity.
For Divita Care, what was their, I made a message at the beginning, what was their business model and how they're going to monetize the care?
So they already had a chain of clinics, a chain of diabetes care clinics in place, and the plan was to come up with a glucometer which had some innovation, which did not need connectivity to an app, it did not need any internet connectivity. It had a SIM card in place which sent out the glucose readings to the doctors directly, and they planned to take this out of India as well. So I think this was a value add to their existing business. So if you have a chain of clinics, you are just like any other chain of clinics. This was a value add which I think they were lucky to tie up with a big company like Vodafone, but I think this is a lost opportunity for them.
change anything, like for example, the HCP receiving the report, or are they just in status
So,
quo?
when I look at their website, they only have clinics in one city as of today. So last few years, that their footprint hasn't increased across India. And also, if you look at the realistic scenario, say HCPs, I have worked in India for 16 years, and this is the real scenario in India. No doctor, many a times in India, the doctor doesn't even have his own phone with him. So the leading specialists, they actually leave out their phones, their emails are checked by their assistants. They don't even touch their phone throughout the day. And expecting these doctors to say look at individual readings of say 100 different patients in a day and responding back to them, that was never going to happen. Also say they could have had a call center in place wherein not the doctor, the actual doctor, maybe a back-end team of HCPs is looking at the blood glucose reports and indicating to them that okay, you're good to eat a dessert. But then if you are the specialist managing a patient, you don't want somebody else to talk to your patients, right? So in a way, they didn't think this through well.